The first thing we're going to do is try to rule out whether or not your lower back is contributing to your hip pain. So I want you to think about, where is my hip tightness? It doesn't have to be pain, but where does it feel tight? Where does it feel stiff? Where is it in pain? And I want you to try to touch it, think about it. There it is. Okay, I've got it. So what Shay's going to do now, we're going to go through some movements of her lower back. She is going to do a full forward bend. She's going to tuck her chin all the way and round her body all the way down. So yes, her hip is moving a little bit here, but the majority of this movement is in her lower back. And come on back up for me, Shay. I'm going to have you put your back on the wall this time. What she's going to do here is put her heels against the wall. She's going to give herself a hug, and she's going to tuck her chin, and inch by inch, she's going to roll her body down the wall. If you're doing this with us, be careful. We don't want you to fall. You'll notice with your heels against the wall, you get to a point where you're feeling like you're falling forward. She's going to run out of room. Once her belt or her kind of pant line is the last thing touching the wall, she's going to realize she has to either put her foot out or stop what she's doing. What she's done is she has moved her spine fully. There is no more movement at her spine. The only way to go forward now is for her hips to move, and the wall is in the way. So if you do that movement and you say, oh dear, that is my hip pain. I feel that in my butt. I feel my hip pain when I do that. That makes it worse, or that takes it away. Very unlikely that it's actually your hip or the tissues of your hip that are having an issue or an injury. Okay? Same thing, we're going to do a back bend. She's going to put her feet together. She's going to bend back, back, back. Very little movement occurring at the hip here, mostly through the back, or the low back and the core. What I want to know is, does this create my hip pain? Does this give me a pinch in the buttock area or some kind of discomfort there? She's going to repeat this 5 to 10 times. You may find, if you've got some buttock pain from sitting, that repeating this gently 10 to 20 times actually relieves your buttock pain. If that is the case, we did not stretch the glute, we did not mobilize or move the hip. All we did here was stretch or move the lower back. So again, if this creates your pain or changes it in any way, for good or for better, it's probably not your hip that we're concerned about. Same thing, last one, she's going to do a side bend either way. Kind of like on a little teapot. She slides her arm down one leg, and she slides her arm down the other. Does this create your hip pain? When you bend to one side, do you feel your hip pain on this side? When you bend to the other side, do you feel your hip pain on that side? If that is the case, again, it's very likely that this is coming from some of the lower back muscles or joints. That's not a bad thing. In fact, it's more common, especially if you're only having tension or pain in the buttock. Okay? But it means that how you approach this might be a little bit different. The next thing you want to do is take a look at some of those nerves. So if you have a chair, that can be helpful. I'm going to pull this guy out here for Shay. She's going to have a seat on this guy. So all the nerves in your body are attached to your spinal cord, which is attached to your brain. So one big piece from my brain to the tips of my fingers and toes. And these nerves have to travel from deep inside your body, from your spine, out towards your skin. So they go through your muscles and around your joints. So what I'm going to do here, Shay's just sitting normally. And I'm going to bring her foot up like this and ask her, does this create your buttock pain or your hip pain? No, she's not having an issue right now. It's a good thing. If I bring this foot up and she says, yes, that is my buttock pain, what I'm going to do, and what you can do here now, is point your toes towards your nose. Does that make your buttock pain or your hip pain worse? If I then point the toes the opposite way, does that make the buttock pain less? And if I repeat this back and forth, pain worse, pain less, pain worse, pain less, in no way am I affecting her low back, her buttock, any of the muscles of her hip. What I'm doing here is pulling some tension on the nerve that leaves that buttock down the leg. Okay? So if this specifically makes that pain worse, very likely our sciatic nerve is what's creating that pain in the buttock. To make this a little bit stronger, if you didn't quite feel it, you don't have to go through this right now. If you feel comfortable, there's no pain with this, that's okay. She's going to tuck her chin down. She's going to curl up into a ball. So I've got her toes to her nose and her head down towards her knees. This position here is maximally pulling through the spinal cord and the nerve tissue. Not in a dangerous way, but if those guys are an issue, you're going to feel it with this. And if I then point her toes away, does that decrease her buttock pain? If I bring her toes back, does that bring it back? If she lifts her head, does that decrease her hip pain? She tucks her head down. Does that increase her hip pain? At no point through this movement am I doing anything to change the structures of her hip. Muscle, ligament, joint, anything like that. All we're doing here is pulling some tension through those nerves. So if that's the case, if you're like, wow, that was my hip pain, very unlikely are you dealing with hip pain specifically, or an issue or injury to the tissues of your hip. Okay, and this is really, really common. You're gonna feel a big stretch down that leg when you do that regardless. And if you feel a stretch there, that doesn't mean it's a bad thing. But if you're like, yep, that stretch is my pain, or wow, when I did that a few times, it took my pain away, bingo. That's what we're talking about, okay? And then we're gonna, again, look at more core and low back based stuff to decrease that long term. So the next thing, we're gonna actually get to the hip specifically. I mentioned rotation, okay? That hip wants to rotate. So what Shay is gonna do here, you can do this in two ways. If you wanna hop on the ground, that's okay, I prefer that way. If you can't right now, that's totally fine. She's gonna have a seat here with her legs hanging. So if you have a chair where you can scoot your bum back and let your legs hang, that's okay. What we're gonna do is test how her hips rotate. And the biggest thing we're looking for is, does this recreate the tightness and the pain that you have? And two, are they the same on both sides, left and right? So the first thing, she can do this if she wants. You can do this if you have a towel, or you can hold your pant leg. We're gonna rotate her hip inward. So I'm gonna grab her foot and just pull her foot out. So her hip is rotating in. And when I do this, I wanna think, how far is that going? Is it 45 degrees? Is it 100 degrees? Is it 2 degrees? Is it none? If you're a little older, if you're male, if you're a retired goalie, maybe this creates some groin pain. Maybe it barely moves at all, and you say, yep, that's my hip pain. I feel that right there. What I feel here, if Shay goes about 50 degrees, that's awesome, no issues. Okay, no pain with that. What I'm gonna do next is rotate it the other way. So again, you can do this on yourself. You can hold your pant leg or wrap a towel around your foot or a band. But I'm gonna rotate this guy this way, bringing her foot in. So rotating her hip out. And again, she's got about 45 to 50 degrees. So in total, she's looking at about 90 to 100. Remember, I said less than 80 might be something you wanna work on improving. Okay? And I had another notification about my internet there. You guys just give me, okay, we're good. Coach Nate, you can see me there? Perfect. Okay. So, does this create your pain? If it doesn't, good. We check the other side, same thing. Bring the foot out, and I bring the foot in. Does this seem to be the same distance? On Shayla, she actually moves a little bit further on this side. Nothing too crazy. If it's not painful, and they both move quite a bit, don't worry about it. But if you're someone who's having groin pain, you might notice that these specifically irritate that issue, and you feel that right away. Okay? So is it the same on both sides? Does this totally recreate my pain? We're gonna hop on the floor now. We're gonna do the same thing. I prefer to do this on the floor if you're doing it yourself, but we're a little bit more specific when we do it this way. So, Shay's gonna have a seat in something we call a shin box, or a 90-90 position. So she's sitting on her bum, she's got one knee turned in, the other knee turned out, with her knee touching her front heel. She's got her hands on the ground, that's okay. What I want you to think about is, can you sit in this position without your hands supporting you? It's okay if you can't. What do you feel in this position? She's now going to switch over to the other side. And I want you to think, how does this differ? Does this feel worse? Does this feel painful? Does this feel good? Does it feel the same on one side or the other? If you can do this without too much discomfort, she's going to do this without putting her hands on the ground. She's going to go back and forth a couple times. And I want you to think, does this recreate my pain? Does one side feel significantly different than the other? Does one side feel way more difficult than the other? So what I'm doing here is just checking that internal and external rotation of those hips. It's a little bit tougher position because the core is engaged with this. If you need to put your hands on the ground, that's okay. But that position is going to come in handy here in just a second. So she's going to stay like that. The last thing for our self-assessment is what we call palpation. Poke and prod. If you have hip pain or tension, can you touch it? Is it in the front? Is it in the groin? Is it in the back? Is it in the side? Can you poke it and you say, yep, that's tender, that's the spot, I feel that. If it is, now we have a little bit better idea where things are going on, and we can figure out something to do to make them feel better, make them a bit stronger, get them a little bit looser. Okay? So, we're going to get moving now, and Shay's going to start from this position. We're going to start with stretches. They're going to be active stretches though, so bear with me. But she's going to come back to this shin box position. We call it a 90-90. She's got the front foot a little bit more forward. So we have 90 degrees at her knee, 90 degrees at her back knee, 90 degrees in the groin area. And the first thing I want you to do is try to get her torso totally upright. So what she's going to do is work on her front leg here. And it's going to be stretching through the glute, okay? So in her case, it's her left glute. She's going to bring her chest and body forward towards that front knee. She's using her hands for support, totally okay. And what she feels is a stretch in her bum on the side that's touching the ground. Kind of the back of the thigh, back pocket area. If this feels really good, that's a good thing. Not a problem there. What we're going to do is hold that stretch. You can spend as much time as you want there. If you start to feel your foot go a little tingly, you're going to back off of there. But there's nothing wrong with being in this position for a minute or so or longer, okay? So here she is in the position. She feels that stretch in her bum. What she's going to do now, if you are looking to make a permanent change in how your hips move, and how much motion they have, you need to get stronger in the ranges of motion that you do not use. So right now, Shayla's hip is in a pretty high position that she doesn't do a lot of activity in. So what she's going to do is drive that leg into the floor. She's going to pretend she's crushing an egg with that bottom knee, and she feels her bum doing this. If you're doing this with us, you probably feel that right now. So she's pushing that foot or that knee into the floor by using her glute. She's not pushing it with her hand. And we're going to hold that push for a minimum of 10 seconds. Really no maximum, but I would say 30 seconds is a good upper limit for now. You're going to start to feel it get a little tired. You're going to start to feel it maybe shake a little bit. What she's going to do when she's done that is try to now lift the knee off the ground. So she's going to put her hands on the floor, possibly behind her. This is a lot tougher than it looks. She's going to lift that leg so she can get it off the ground about 1 or 2 inches. You're going to feel this right in the groin, in the front of those muscles. So what we're doing here is just stretching the hip into a position and then strengthening the muscles on both sides. Okay? Pretty easy. You don't need any gear. I would recommend a mat or a nice carpet floor, but simple way. And she's going to repeat this a minimum of 3 times each, a maximum of however many times you want to do it. If you're relaxing watching TV and you want to stretch those hips out, get them moving, you can do this for an hour if you want. You'll be tired, you'll be shaking, but fantastic way to improve those hips. Okay? At the same time, she's now worked on the back of her left hip. We're going to work on the front of her right hip. So from the same position, she's going to sit back and drop her right buttock towards the floor. She's going to feel this like a C right around the front of that right hip. Okay? Kind of deep in the butt, coming around like that. What I don't want here is a sharp pinching sensation in the groin on that side. If you feel that, take this one slow. We'll talk about that or send us a message. So she feels this here now. Again, we are going to stretch for a minimum of 30 seconds, maximum a minute, 2 minutes or so. But again, as long as there's no pain, it's okay to be there. Once she's done that, she feels the stretch is kind of relaxing off a little bit. She's going to take her hand and put it on top of that knee. Now she's going to gently lift that knee up into her hand. So she's using those muscles that she's currently stretching. And again, we're going to hold this minimum of 10 seconds. Goal is 30. You can do longer if you want, but this is not super easy. So she's holding, she's breathing, she feels some strain in those guys. When she's done that 30 seconds, she relaxes the leg. Now she's going to try to lift the foot off. Good. You'll notice she kind of leans forward a little bit. It's okay if this cramps a little bit. It's not a bad thing. It doesn't feel awesome, but it will get better as things get stronger. So the same as we did with the other leg, she stretches the hip out into a position and then strengthens the muscles on both sides. The more you do this and the stronger they get in those positions, the more you will be able to have those positions without tightness and issues and pain. So you'll notice these are our rotated positions. If you are lacking rotation, this is how we get it back. It's not super quick, but as you put that effort in and you do this repeatedly, you will see that get better and better. If you are a goalie, this is a big one for you. This is a daily. Okay, if you're watching TV, don't sit on the couch, get on the floor. It's nothing crazy, you'll be nice and comfortable. Easy way to just keep those hips moving in the positions that you're gonna need for the rest of that career. Okay, those guys need to rotate to decrease our groin injuries and our low back injuries. Pretty common in hockey players, really any sport, but big time, okay? She's now gonna switch sides. And you'll notice, now we're in the exact same position the other way. So now we're working on the back of the right hip and the front of the left hip. Same exact thing. We hold the stretch for a minimum of 30, upwards of a minute, 2 minutes maybe. She's now going to push the knee in, pretend to break that egg. Feel the buttock doing some work there. After 10 to 30 seconds, she's going to lift it off by putting her hands on the ground for a bit of support. And we're going to repeat that, hopefully a minimum of 3 times each. If you've got lots of time to put into this, you can do it 10 or 20. Do it as many times as you need or you want to. But if you're short for time, just do it once each. Just getting there is a good thing, okay? Next piece of the puzzle, bang for buck, hip exercise is going to be what we call the couch stretch. You may have seen something similar. We're going to use the block here. Your couch would work great. It's a little bit squishier. A couple of big pillows or a rolled up yoga mat. We are not looking to jam your knee into the hard floor here. So Shay's going to put her foot on the edge of the block. You're going to put your foot on the edge of your couch. She's going to drop that knee onto this pillow, okay? You'll notice right away, big strain right through the front of this thigh. What I want you to do is try to keep this a lot less than a big strain. We don't want it to be anything super, super strong or painful, okay? So if you lower the couch or add pillows, it's going to decrease how tight that is. Because what we need to do in this position, we talked about stability of the lower back and pelvis. Shay's going to tuck her tail under. Okay, so she's not arching her back, she's flattening her back by using her bum and her core muscles. And as soon as she does that, the stretch in the front of this hip and thigh goes way up. Okay, and again, we don't want it to be too strong. This is another fantastic watching TV, watching sports kind of stretch or mobilization for the hips. Gets the quads moving, opens up the knee a little bit, lets the low back loosen up a bit. Fantastic way to loosen up some tension through those guys. There's a number of different ways we can go about dealing with this once we're there, but this is a pretty good start. She's going to hop out of there because that's a little tight, okay? We got one more good stretch before we do some other movements and drills, okay? These ones are going to be for all the big muscles on the inside of the thigh. They're called your adductors or your groin muscles. So Shay's going to pop a knee on that pillow and one leg all the way out to the side. Hands on the ground in front of her, nice and sturdy. This is called a rock back. So what she's going to do is keep her back nice and flat. She's going to rock her bum back towards her heel. As she does that, she's going to feel the tension on the inside of that thigh, inside of the knee, go up a little bit. We don't want it to skyrocket. Don't blow through it. Nothing too crazy. Okay? She comes back. She feels the tension. She removes back to the start. So come back, find the tension, back off. Come back, find the tension, and back off. 10 to 20 times each side. You can spend a bit more time there if you need. This is a fantastic one to open up the groin, the hip, the inner thigh, and the knee muscle, okay? Same thing, we're going to do this with both legs. So instead of both of them out far, she's just going to bend the knees and put them out again. Lots of pillows with this. We don't need to be jamming our knees into the hard floor. She keeps her back nice and straight. She sinks back towards her heels, feels a stretch right up in the groin on both sides, maybe a little bit into the back of the hamstring region, and then she comes off the stretch. Come back in, feel it, and back off. Biggest thing she's trying to focus on here is not rounding her back as she moves. So there is zero movement through her spine or her back as she does this. She's just rocking into the stretch and backing off. Rocking into the stretch and backing off. As many of those as you feel. If this feels real good, go to it. Again, it's come in, back off, come in, back off. So now that we've loosened those hip joints up a little bit, we are going to move them. If you are anybody, if you're having hip pain or tightness because you're sitting a lot, or if you're having hip pain or tightness because you're super active, this is the one for you. These are called controlled articular rotations, which is a fancy way to say a slow joint circle. Okay? So we're going to do this standing and on all fours. So Shay's going to stand here with her hand on the wall. You can put your hand on the back of your couch or on a chair, something to keep you nice and sturdy. What she's going to do is bring that knee all the way up. You'll notice what she's doing is trying to keep her body still. She's then going to bring the knee out without turning her body. So just the movement through her thigh. She's going to turn that hip so the foot comes up. She's going to reach it back around to finish that circle and then back under. I know this seems simple. The goal of this, minimum of 5 seconds per circle. Okay? Longer or slower is better. She's going to pretend there's a pen on the end of her knee. She's trying to draw the biggest, slowest circle that she can without moving her body. You will feel all of the muscles in that 360 degrees around that hip working really hard with this. What you're doing here is moving that joint, pumping the fluid that's inside that joint, nourishing the cartilage, lubricating the hip joint, and pumping some blood into those muscles, getting things active. She's going to do the same thing on all fours. I would recommend both for you, but the standing one's a bit easier because you can do it anywhere. So from the same thing, she's in a nice sturdy all fours position. She's going to pretend there's a cup of water on her back. So that when she does this, she's not moving or rotating through her back at all. So very slow. If you're just whipping these off, you're not doing yourself any favors, okay? The slower the better. She's going to go about 3 to 5 times in each direction. More is good. That's totally okay. But if that's all you have time for, awesome. The more you move that joint, the more you're going to be able to move that joint. Whether your joint is stiff from not moving it or whether your joint's stiff from loading it like crazy in sports and things like that. The last one of our mobilizations before we get into some strength or some endurance techniques for the hip, we call it a rotation transition. You've already kind of seen it, but we're going to do this with a bit of support from the hands. So Shay's going to sit on her bum with her feet out in front of her, and she's going to pop her hands in behind her. So she's got her heels pretty wide, and what she's going to do is just dip one knee, or both knees in one direction. Good. So one knee's rotating in, one's rotating out. Okay? And at best, she's going to try to keep both sides of her bum on the floor as she does this, but it's okay if it lifts off a little bit. Okay? When you're back like that, it's going to remove some of the tension or any potential pinching in the groin area. So all you're doing here is just greasing the wheels. Just rotating those hips easy, nothing crazy, seeing how they feel. But again, this is a super easy one. If you've played hockey, you've probably sat on the ice at the start of a game or a practice and done this a few times. It's a good thing. Do it every day. Keep those guys moving, okay? So we're going to get into some activation exercises for the hip muscles now. If you have a mini band or a band loop, that comes in handy. You don't necessarily need it. What Shay's going to do here is something called a clamshell. So she's going to bring that band up just above her knees and she's going to lay on her side. Good. So she's got her hips and her knees on top of each other, what we call stacked. She's going to keep her feet together. She's going to lift that knee up towards the ceiling, trying not to roll her body backwards. She's going to feel the muscles around her back pocket working real hard to do this. The slower the better. Okay? This is not a huge exercise. It's nothing too difficult. We're just pumping blood into the muscles at the back of that hip. So if they're getting sore and achy because you've been sitting on them all day, this is a really good way to make them feel better. If you've had an injury back there, this is a really good way to start making them a bit stronger. Okay? We're looking at pretty high rep, 10 to 20 or so, or until you feel fatigue. Repeating this on both sides. On the other hand, same thing. She's going to stand on up. An exercise that is a little bit tougher than that, but pretty much the same thing. You call it a monster walk or a lateral walk. She's got the band a little bit lower. She's going to take a semi-squat, drop her bum a little bit. She's going to slowly step to the side with one leg and follow it with the other. Okay? She's going to pick about 10 feet. She's going to go back and forth, slow and controlled. Don't let that band snap your legs back together. Make those muscles do the work. Make them control your movement. I would say time is a good one for this, 30 seconds, maybe 2 minutes, because you're going to be using both sides. You're just going to go until they feel some fatigue. She's going to hop back down on her back here, okay? So now we've addressed the muscles on the side and the back of the buttock. We're going to go to the ones on the front, the hip flexors. If you're a runner, if you're a sitter, if you're a hockey player, if you're an athlete, if you're not an athlete, these guys need to be pretty strong, okay? So she's got the band around her toes and her legs are out flat. What she's going to do is brace her tummy. She's going to march one leg all the way up to 90 and pause. She's then going to slowly let it come back down. She's going to repeat this 10 or 20 times on one leg, and then 10 or 20 times on the other. Or you can alternate them side to side. The goal of this is to feel some burn right through the front of that hip, right around that front pocket area. Shouldn't be super painful. We're just pumping some blood into those guys, getting things active, getting them moving, okay? Really, really effective if you're having low back or hip pain or tension from sitting, or again, if you're doing a sport that's high explosive, running, soccer, hockey, that kind of thing. Get those hip flexors moving and strong. Okay? We're now going to do the back of the hip muscles, so the glutes. So we'll ditch the band. Again, we're keeping things relatively simple. If you're looking for progressions or something more difficult, let us know. But if you master the basics, things are going to go well. So she brings her knees up a little bit, her feet are on the ground flat. What Shay's going to do is squeeze her bum and drive her hips up to the ceiling. If you have lower back pain with this, don't drive quite so high. Okay, and at the top, she's going to squeeze her butt and hold. This isn't super challenging, we're not pushing a lot of weight. So all we're doing with this is trying to get the glutes active. So I'm going to say something that might seem a little funny here, but when you're up at the top, I want you to squeeze your bum like you're trying to crack an acorn. Okay, I know that sounds kind of weird, but everything's going to contribute here. Your lower back, the back of your thigh, your calves, everything. We want the butt to do most of the work with this. Okay, so she's squeezing at the top and holding. I did mention that health of that hip involves stability of the pelvis. So what Shay's going to do now is what we call a one-legged bridge. If this is a little bit too difficult for you now, that's okay, we'll get there. But she's going to march one knee up and pull it towards her torso as much as she can. She's now going to use the other leg and drive up and hold. So what she's trying to do here is limit her body from dipping and swaying to either side. So she's nice and strong through that pelvis. One leg pushing one leg, the other leg pushing the other. Kind of looks a lot like running, doesn't it? Okay? We're going to do these again on both sides to some degree of fatigue. If you want to try for 10, that's fine. If 5 works better for you, that's okay as well. The last exercise we're going to do, really, really simple, or seems simple, but can be quite challenging for the muscles on the inside of the thigh, the groin muscles. Shay's going to take her top leg and put the foot flat on the ground. This is kind of like the Jane Fonda leg lifts, okay? What she's going to do is take that bottom leg and lift it up towards the ceiling. So the inside of her foot up to the ceiling and hold. She's going to feel tension right down the inside of that bottom leg. Once she's up there, she can do some small circles with it. You can pretend to spell your name in the air. Anything to just drive some blood flow into those muscles, get them working, get them active. Again, if you are a goalie, a hockey player, a soccer player, if you're doing a sport with a lot of lateral movement, or if you're someone who has pinching or pain in the groin area, do this exercise. Give this guy a try. Okay, it's not super difficult, very effective at getting those muscles working, and a lot of the times taking care of a lot of that groin pinching or pain. So we're keeping in mind in our assessment, where did I feel my pain when I touch it? What did I feel when I rotate my hips? Maybe I'll choose some of these exercises to pick away at what I found. If you found some of those things and you said, you know what, how do I know which exercises to do? Again, the hip rotates in all directions, so the odds are you're probably going to want to do them all. But if you found one of them that you just tried with us and you're like, wow, that feels really good, I like that, put your money there, stick with that one, okay? So, guys, that covers everything we're going to go through today. Again, we are going to send a handout with a lot of that information and some of those stretches or movements for you. And we are going to be posting this to YouTube, so you can kind of watch it at your own pace and go through it. I know some of you guys who, some of the names we see on here, we've seen you in the gym a few times. You probably recognize quite a few of those things. There's a reason this stuff is in your training, okay? And these are the kind of things that if you do every day, you're going to maintain some of the health of those areas. If I want healthy hips, it's not always about loading up weight on a bar or jumping and moving super quick. I just need to move those joints every single day. If I find an area that they feel like they're lacking or I want them to be better at, or maybe it's an injury I had in the past, maybe that's going to guide what I'm going to try. I'm going to do a different exercise more frequently. So give that a shot. If you have any questions, please send us an email or reach out to us, or if you have another therapist or someone you trust or you've spoken to in the past, let them know, and I'm sure they'd be happy to answer any questions you have.